I'm going to record this. That leads me to our topic of the day. So those of you who have been with us over the last year know that about 6 months ago, we started having panel presentations with aging life care managers. And those are some of the best discussions that we've had. And I am super excited that today we are going to get to meet the leader of the association that all of these folks are members of and learn more about the national movement, how this association works. And, you know, the other exciting thing is I've seen by some of the comments, we've got a bunch of Aging Life Care Association members in the audience. So we can solve some problems for some of you in the audience. So without further ado, let's bring on Taney Hamill, who is the CEO of the Aging Life Care Association. Taney, welcome.
Thank you, Steve.
I'm so charged up to have you today.
Thank you.
Before we
I'm
dive
charged up
in,
to be here.
Yeah, before we dive into the association and what it does and the profession, tell us a little bit about your background and what led to you being the captain of the ship over there at Aging Life Care Association.
Well, I think it's a combination of my entire career. I started out as a therapeutic recreational therapist out of the University of Maryland back in the day. I'm not going to tell you what year. And I went to work for Recreation and Parks Department and did a lot with senior citizens. I then moved to an area agency on aging. And then I sold a product. I was the 25th employee. It was called Lifeline Systems Incorporated. Push the button, help, I can't get up. So I actually knew Andrew Dittner, who came up with the PERS initiative and industry. And I worked for them, traveled in my territory, which in different years was different states for 5 years, and then ended up having a baby and thinking they can't feed themselves at night. It's not like having a cat. At least that's what my friend Tina Morelli from Home Care told me. And from there, I ended up working in the durable medical equipment industry. Yes, sometimes the bedside commode is the most important thing in the home, believe it or not. And I learned that you can't just close the door and turn on the concentrator and think you're going to have oxygen either. I learned that. Then I went to the national level and I went to an association. Today it's called AA Home Care. It's the Association for Durable Medical Equipment. At that point in my career, before I went to AA Home Care, back then it was known as NACCM, National Association of Medical Equipment Services, I went to an educational session put on by Jeannie Bowling and Tom Strickland, the father of case management, and Jeannie, the first CEO, the care management, not the first, but the first full-time CEO of the Case Management Association of America. I met case managers and I loved them and I was involved with them, wrote articles for the Case Manager magazine, went to all their meetings for the next 15 years. As I did that, I went to work for one of the credentialing organizations called URAC, which accredits case management organizations, HMOs, PPOs, and a number of other health entities. From there, I went to the Health Insurance Association of America. That turned into the National Association for Health Plans today. I also ran a nonprofit foundation for senior executive women in healthcare. You had to be in the C-suite to be in there. And that organization's around healthcare senior executives getting on the Fortune 500 boards in this country. As we all know, that women don't have a lot of those board seats. And the projection is better today than it was 20 years ago when that organization started. But we're still working hard to get women into boardrooms because we know that the outcomes for for-profit companies are better when we have a diverse board. I, throughout my career, have done executive search on and off. That's another passion of mine. That's another story. But I've also worked for the Visiting Nurse Association of America. When they were in existence, I was the executive vice president for 3 or 4 years doing that, and then ended up seeing this job opportunity and thought, what is a case care manager? How's it different than case management? And boy, over the last almost 4 years, 3.5, that I've been here, I've learned a ton, I understand a ton, and we've just gotten ALCA, the Aging Life Care Association. We just have an alliance just in the last month with CMSA. So I guess I've come full circle.
Yeah, this is great. No, the association and the profession are so lucky to have you. And it's
Thank you.
With the breadth and the different things that you've done, I know just makes you a really great leader. And I've talked to so many care managers who are members that are part of your fan club.
Oh,
so,
good.
You sent over a slide deck here.
Yeah.
I'll share with you that I thought was really good. And before
Okay.
we dive into that, I just want to remind the audience that if you've got
please.
any questions, just use that button at the bottom of your screen, type it in, and don't worry, these don't need to be corporate level ALCA aging life care questions. It can be, hey, I'm dealing with my mom, this, that, and the other. In fact, yesterday we had your cohort on for the for NACCM, this National Association.
Oh, they're an alliance too. I saw that. The move managers.
What was interesting is the amount of downsizing questions from older adults and families that were in the audience were just fantastic. And so today, we're talking about solutions, but
right.
Let's learn a little bit more about this profession and dive into it.
For those that are on this, that are our members, I think you've seen these, but I also, these slides, I think you need to know that we use these slides all the time to tell others, whether we're talking to some of the home care corporate partners of ALCA or whether we're talking to others. We use these slides a lot, so you may have seen them. So for those of you that know, care management's been around a very long time, and it's not just since 1983 when the New York Times article was published, but years before that, there was care management. So care management really started to come together at a national level based on 1983 when the New York Times published the long distance care of the elderly, relatives, which was a growing problem. It attracted people in Florida. They put together people in Florida, people in New York, and New York is where the center kind of happened, and then people across the country. In 1985, those folks that had met in New York, in somebody's living room, decided, let's have a meeting. 50 attendees from across the country. And that was huge. Still no association. Shortly after that, there were volunteers that put together an association. And I think it really kind of started in New York. I didn't throw the slide in to when the different chapters, because we have 9 chapters within the organization, came together. But it was first run by volunteers. And then the volunteers went ahead and hired a management company. And that management company was located in Tucson, Arizona. And that's how we came to have the corporate office in Tucson, Arizona. We do have access to an office now in Washington, D.C. Thank you very much to our attorney, Hugh Webster. We get to use his office whenever we need to. So we do have a satellite office in Washington now, which puts us in the middle of the aging offices and the aging national trade associations and societies. So in 1996, the industry decided that they needed a credential. CMSA, Case Management Society of America, had established a credential for case managers, and so care managers established the National Academy of Certified Care Managers, CMC. And that is still a working credential. We still have people coming through that credential every day. We'd like to have more. We'd like the word to get out there. It's really, truly the credential for care managers. In 2021, the National Association, and I'm going to blow that, of Geriatric Care Managers, which is what this industry was called for years, becomes self-managed with 2,000 members, which means they hired their own CEO. They started to hire staff. In 2020, 2012. In 2015, there was a rebrand. And I guess there were some words in geriatric care management that needed to change. So we changed the organization to Aging Life Care Association and Aging Life Care Professionals. And that branding has been continuing forward. We still have care managers that talk about themselves as geriatric care managers. We still say, and I've still explained to people, we're the same organization as the Geriatric Care Management Association. In 2020, we celebrated 35 years of leading as an organization, knowing that we've been around a lot longer. But so I would say the industry's been around 40, 45 years, but as an association, 35 years. And that's significant in the industry. So with that, I'll talk a little bit about what is a care manager, and you can ask me how is it different from other professionals. Care managers are vetted. You can't join today our organization unless you've been vetted. You're credentialed, you're experienced, you're skilled in providing personal decision-making support with a long view perspective for the elders and persons with disabilities. Our members come into an environment where they are there for an extended amount of time. They may only be there an hour a month or an hour a week, or they could be there a couple times a week, but they are there for the long haul when families and clients, caregivers, and folks that are paying for the services need them. We have a code of ethics and a standard of practice that our care managers abide by and follow. They're knowledgeable. They specialize in training, experience in the field. We do ongoing training, ongoing continuing education credits, and anybody, member or non-member, can take our education. And we have some phenomenal speakers, whether it's at the national level or at the local chapter level at conferences. So that's who a care manager is. Let me tell you a little bit about their knowledge areas, and there are 8. They work hand in hand with elder law attorneys. That's who they'll refer to, and there are usually a lot of relationships that are built on the local level. They advocate for their clients, their families, their caregivers too. They understand, because they're local, they understand the local resources, and that is so key. And if they have somebody, if they're referred to somebody and they end up, I've got care managers that live in Florida and fly to Boston for some of their clients. They'll go and work with other care managers in other states to make sure that they understand local resources. They work with families. I can tell you a quick story. I'm the oldest of 7. And yes, when my mother in Bethesda, Maryland was, we were going through family dynamics that were not great, we hired a care manager in Bethesda. And it helped. And this was before I had the job, and it was my first experience with care managers. But we know families can get squirrely, mine in particular. They help with housing. Is the client living in the appropriate level of care? Is the home in the right, is the home right for the elderly person in the home? What about all those throw rugs? What about, are they going to trip? Can they reach everything? Can they walk? Oh my gosh, can they still do stairs? Is the shower on the 2nd floor and no longer can the client do stairs? That's what happened to my mom. So they look at that, they help with that, they help the family with that. They look at financials, they work hand in hand with money managers. If clients need help, they'll pull in a money manager to manage the money, help the family. Or they work hand in hand with other people that are involved with the finances. They look at health and disability. We do a lot of education in healthcare and things that happen to the elderly. And of course, they're there to go to the physician's office, make sure the pills and the meds are being taken care of right. They also, if the patient ends up in the hospital, they will, I want to show you something, they will go to the hospital and be the first one there. And hopefully they'll take the emergency folder that we've developed for care managers, which that the patient takes in the ambulance to the hospital. It has Aging Life Care, and inside it has all the information about the client, and it has the care manager's card. We're trying to get this out nationally, so ERs, or emergency departments across the country, when they see these folders, they know that there is a care manager involved in this case. And they're there for crisis intervention, whether it's the family crisis, the caregiver's crisis, the client's crisis, they are there. So let's talk for a minute about when to call a care manager, when to refer. First of all, I'm going to tell any of you out there, start the relationship before you need it. Start an elder law care relationship, start a money manager relationship, refer back and forth to each other, go have coffee. And I'm also going to urge our care managers to network with each other. You know, go have lunch with somebody, go have dinner. I'm thinking that I should start doing dinners in the Maryland, Virginia, Pennsylvania area, because I live here. And we just get together and chat and maybe talk about a case. We also have units in almost every chapter, and those units get together on a regular basis and do some of that. But in some of the areas where they're not units, maybe we need to do something else. There's a place in North Carolina where a care manager said to me, you know, there's 3 of us that are members, and then there are 3 of us that are not members. Can we do a unit? Is 6 enough to start a unit? And I said, go for it. Just talk to your president of your chapter. So you should refer to an aging life care professional if there's a crisis. If you're confused about options, you don't know which way to go, you need an advocate. And I'm going to tell you, my brother, who's only 59, just spent 31 days at a hospital in Northern Virginia. He had advocates, and he had family that would not let him stay overnight in the hospital alone. Everybody that goes into a hospital needs an advocate. If there's memory loss, what do you do about that? Call care manager, they'll help you through it. Oh, and that family conflict, I wouldn't know about that. That was a number of years ago, but I'm going to tell you, that's really important. And what happens if an elderly person is refusing help? They're in their home, they're all alone, and they don't want help. Call a care manager. They'll go in and develop a relationship with that elderly client and make things better. So with that, you can find a care manager with going to our website, push the orange button on our website, and put your zip code in, city and state, and up everybody will pop. So, and then you pick the care manager that you have a good feeling about. You pick the care manager that you think you need. If it may be social problems, maybe you'll pick a social worker. If it's a complex healthcare case, you may pick a nurse. Wait a minute. There are different specialties in aging life care. There's no one career path. Everybody comes in a different way. So and usually this is the second or the third career for people that are aging life care professionals. They may be a nurse. They may be a social worker. They may be a physical therapist, an occupational therapist. They may be a recreational therapist. They may be a gerontologist. They may be a counselor. So there's no clear career path for us. And we are trying to establish that, but and bring more people in. But so go look at qualifications, go look at the pictures. We're trying to get everybody to have a picture on our website, and pick a care manager to help if you need it. So with that, are there any questions?
Yeah, this has been great, Taney. And what I'm going to do here is stop sharing, and I'm going to drop this contact info into chat, of which everybody has seen. I've been, as you were going through things, I was dropping the links to the websites that you were referring
I saw that. So I say CMSA, thinking everybody knows that's the Case Management Society of America.
Yeah,
Sorry about that.
So there's a question, what is CMSA? It's the Case Management Society of America. I added that in there. Somebody else sort of said, what certification courses would you suggest for care managers? And we talked about the certified care manager credential.
Right.
And then,
and we offer courses to prep for that. And
Yeah.
there are care manager books out there. Kathy Crest has written one, and I think she's on her 4th edition. She's fabulous. There's Shanna, can't think of Shanna's last name, Hubert. And she's written a book with another care manager in the association. It's like a textbook. It's fabulous. It's just come out. I applaud them. It was a lot of work during COVID to get that. So you can get a book, you can take a course, or come look at our website. You can join any of our education anytime. And we do both business education and clinical education.
Great. And okay, questions are coming through. The Susan Bloom, who is a aging life care manager, she says, you have mentioned this, but can you differentiate between what a care manager and a case manager does?
You know, and if there are any case managers on here, I'm hoping to put a panel together for our annual meeting to really talk about this. But I think case managers operate with a beginning and an end. Same with health advocates, a beginning and an end. They're not with the client or patient for long periods of time. They may be if there's a chronic disease and they're a case management with the insurance provider. But our members are a little different than that. Once they get involved, they usually stay involved. If there is a stop of service, they may be called later on to come back in. So care management is about care, long-term care, or care across the continuum. I think case management is case. They do a case and they're an end of the case. If you work for a payer as a case manager, you may be involved with making sure the best care gets delivered to make that person well or get that person to a point where they then are either taken care of. But care management is really extended across. It may happen before an acute episode. It may happen after an acute episode, but that acute episode doesn't have to happen for care managers to get involved. They get involved for all those reasons I talked about. Does that help? I don't know whether anybody wants to add. I hope so,
but like you had said, if there's a case manager in the audience that would like to elaborate on their profession, by all means, you raise your hand or type it into chat there. And Susan Bloom, I know there's some aging life care members in the audience. Make sure that you all just drop your contact information into chat, and also feel free to jump on our discussion there and some of these questions that we're
case
getting.
Managers and care managers can collaborate.
Yeah, absolutely. Yes.
I think another difference, Steve, if we look at it, case managers today, and this was different when they started, a lot of case managers are employees. Care managers, a lot of care managers are still, they own their own companies. Even though we're still a small cottage industry, a lot of care managers own companies. They may have 10, 3, 5, 15 care managers working with them and other disciplines working with them, but they're not huge organizations. And so I think that's another difference. And I think it goes back to really understanding resources in your community. We do know that telephonic care management is out there. It's happening, and it's being sold to payers and employers. We know that one of the big companies out in New York just got a huge influence of investor dollars. So we're going to see more telephone, which is new for us. We're going to see new telephonic care management. And after last year, we understand that when we can't get in to see clients, if we can talk to them on the phone, that's important. I think historically care management has been, we see them, but because of last year and because of the telephonic care management that's starting to take place in this country, there is a change going on.
So I'm glad you brought up payer sources, because somebody asked, does insurance or long-term care insurance pay for and cover the services of a care manager?
My understanding is that there may be some Medicare Advantage plans that may be paying for some of it, but and don't quote me on that. I'm not totally aware of that. We probably should investigate that. We're talking about we know there are care managers working in Medicaid programs, and we are hiring. We're looking for a membership full-time manager at ALCA. And if you know anybody, let me know. And I think we're going to have that person look at Medicaid care managers first. What are the Medicaid programs across the country doing on that? But long-term care insurance, I think sometimes you can get, those long-term care plans are all different. If you've seen one, you've seen one. Yeah. And some of them may pay for something in the home before you go into the long-term care facility. But again, that's a question to ask at your unit level, your chapter level, because I'm not real sure that we see a lot of that.
Mm-hmm. No, and if there's any, we usually have at least one long-term care insurance expert in the audience.
Did Byron just answer that, Steve, in the chat?
Yeah.
Say something? What did Byron, listen to Byron. What did he just say?
Yeah, long-term care insurance can cover some services. So
listen to him, because he's chair of NACCM, our credentialing board.
Oh, great.
And he's a past chair of ALCA. So he's a past president of ALCA. So he knows.
Great.
I talk to him all the time. He helps me.
Rajan, and I know I mispronounced your name there, says, I'm a realtor with the SRES designation, Senior Real Estate Specialist designation. I was looking at joining Aging Life Care Association recently. I'm focusing my business on working primarily with seniors. I see you can take an exam without taking the class because of my SRES designation. What would you recommend for somebody in this profession? And I'm glad you brought that up, is sort of, so, I mean, potentially an SRES realtor could also become a care manager, but are there other ways to affiliate with your association?
Yeah, she really should join as a corporate partner. And we have about 170 corporate partners this year. And you get to join both the overall organization across the country, and then you pick a chapter. And of course, we have some folks that are in every chapter. And so then they're involved at both the chapter level and across the country at the national level. So my urging for her would be certainly pick up the phone and talk to Sarah in our office and say, Sarah, which way do you recommend I come in? I bet you, Sarah, you want to do real estate. You don't want to do this day in grind that I'm sorry I said it that way, but our care managers have to do, taking people to doctors, going into the home, rearranging services, working with those crisis families. You want to sell real estate and help people get the right home at the right time and the right kind of home setting. So my suggestion is really don't join as a corporate partner. But if you want to be a care manager, well, come on, we'll help educate you. We're about to launch onboarding modules to help anybody that wants to come into the industry.
That's great. And let's see, a few questions on some things that you brought up. I was looking at your website. I don't see that job that you had mentioned, the membership
posted.
Coordinator.
I can get it to y'all. If Steve, we'll get it to you and you get it out to your to everybody.
And that was it's a full-time membership.
It's a full-time membership manager's job. Best scenario is we find somebody in Tucson, so they have an office to go to. But if we can't find the right candidate in Tucson, I'm open to somebody being remote. I would prefer them being in the Tucson area. We're not, because I'm already remote. And we have Callie part-time remote, and Pam, who's our contractual meeting planner, is remote. And guess what? Karin works for us a little bit too, who used to be the executive director of ALCA, the CEO of ALCA. She's the publisher now of our peer-reviewed journal, and she is helping our NACCM program, the Byron chairs, become accredited. So she's still in the industry. She's still working with us.
Great. Okay. Let's see. I've got a good one that I want to get to here, but I want to get through a few of these. what is the cost of the certification courses that you offer?
Off the top of my head, I don't know. Go to the NACCM website. They're all there.
Okay.
There is a website for NACCM. So go ahead
Yeah.
to the NACCM website and it's all there.
That acronym
Sorry.
again,
I'm sorry.
NACCM stands for?
Hold on a minute. NACCM stands for the National Academy of Certified Care Managers. I'm going to get nailed for not knowing that right off the top of my head.
I didn't mean to put you on the spot there.
It's okay, not a problem.
CEO.
I'll talk my way out of it. Don't worry.
Yeah.
And
then
I hope is Byron still on.
Yeah. Okay. So, I've got, okay. Now I put a link to the Kathy Crest book in that you mentioned. So hopefully everybody's got that. What was the other book that you mentioned? The new one? It's like a textbook.
You know, as I said, today is my first day in 3 weeks. Okay. If you stay right there, I'll go get it.
Okay. And while she is going to get it, when she comes back, we are going to talk about telephonic care managers. But okay.
Oh, would it help if it was right way up?
Okay. It's the Life Care Management Handbook, and
it's by Shanna Huber and Jennifer Crowley. Jennifer's out in the West. Shanna, I think, is in Ohio or Indiana. And we did a chapter, ALCA did a chapter in this book, as we have in Kathy Crest's books. And so some of this history is all in the book. I know that Shannon and Jennifer want this to be in a book that anybody in a university or college could use. So, and you can get this book on our website. We're selling this book with them.
All right.
So please go to ALCA to get this book.
Yeah. Is that in the store? Because I couldn't.
I think so, yes.
Okay. I apologize. If you guys can find it on ALCA, Aging Life Care, but I just dropped in the Amazon link to it.
You buy it on ALCA.
No, definitely support ALCA over Jeff Bezos. Not that I have any. So, because I pretty much, do. Okay, so, all right. You had brought up payer sources and telephonic care managers. A few questions. People wanted you to elaborate a little bit more on that. The telephonic care managers, because we've had some of our aging life care managers on who are now in the pandemic doing telephonic and Zoom care management. But if you could elaborate on that a little bit.
On telephonic care management?
Yeah. You were talking about a company that,
there's a company by the name of Wellbe. I've met the founder and I've talked to her, and she had a mother that she helped take care of through her teen years and in her 20s, and how difficult, as we all know, how difficult it is to take a sick or aging parent on by yourself. It's 24/7. And so she founded Wellbe. And Wellbe is a telephonic care management company. I'm going to stop there. I don't know more about their company, except that I know that they're hiring care managers. I think they're predominantly nurses that do it telephonically. And so I'm sure they've got, they've trained them, and some of them may be members of ours. We would love to have all of them as our members and help to continue to educate them on all different kinds of things as we develop these relationships with Lewy body disease, or with dementia, or with CMSA, the case managers, or with the other folks. We're trying to bring alliances to ALCA that can help educate members, that can help educate others that want education through us, so that the best care can happen for the client. And and health advocates are also welcome to come in and take our education and learn. Great.
Okay, so so that's real exciting. And Suzanne Weisberg says Wellby, Wellby, is that what you?
Yes.
Okay.
Well, they're in New York. You can look them up. They're in New York.
Yep. Okay, great. I got their link. I'll drop that in for everybody.
And that's right. One. I think there are probably others at this point in time, but I don't know of others.
Okay, great. But I can see that as these companies sort of pop up, one of your organization's goals is going to be to collaborate and make sure that they're abiding by the principles of
Absolutely.
the organization.
Absolutely. And also, let's bring them into the tent in some way, even if it's just asking them, hey, do you want to join us for education? Come to the conference.
Mm-hmm.
Oh, by the way, conference next year in Orlando.
Oh, okay.
Sun, surf.
Yeah. Well, and for those that have been to the national conference, it's a wonderful opportunity. There's vendor and corporate relationships that can be forged there, but I've always found it to be very exciting, even though I primarily am based in the Mid-Atlantic. The ability to talk to care managers from all over the country and kind of hear what's going on in the different regions is really interesting. And like you said, Taney, for the care managers to meet with their cohorts and their colleagues that they don't get to see that often, lots of ideas incubate at the
just being able to network, and they learn so much from each other. And then what happens is, I'll give you an example. Connie McKenzie, who's the sitting chair of our board, who is out of Fort Lauderdale, Florida, been a member for a very long time of the Florida chapter, managed a multi-practice of care managers within a home care organization. So the owner was not Connie, it was somebody else that had both home care and care management. When Connie left there and went out on her own, which she did about a year and a half ago, I said to her just recently, I said, how you doing? She says, I'm busier than I've ever been in my life. She said, my referrals are coming from people I know across the country. I'm not marketing. I don't need to market. And she's also brought a partner on with her, and she's as busy as Connie is. Connie has clients in different places in the United States, and she shares those clients with other care managers that do guardian work. And she says, the reason I'm so busy is because I've been able to meet care managers across the country. We trust each other, we respect each other, and we refer to each other. And you can do that April 6th through the 9th, 2022, at ALCA's annual conference in Orlando, Florida.
Okay, great.
How was that for a plug?
I love it. And then a question came up sort of talking about the national and the chapters, and Taney is the CEO of the national organization, but then I cut and pasted a link of all the regional chapters. And I know like there's a Florida chapter, a Mid-Atlantic, a Midwest, a New England, a New Jersey, a New York, a South Central, a Southeast, and a Western region chapter.
Very good. And you read that. Most of the time I have to do that off the top of my head. So we're all one organization. When you join ALCA, you join the national organization. And then you choose which, and we've got members that maybe live in New Jersey, practice in New Jersey, but also are members in New York. And so we've got some of the folks that sit on the line of 2 or 3 states, maybe members of 2 or 3 chapters. And we can make that happen. And for corporate partners, it's the same thing. You join the national organization and then you choose. And so for organizations that are located in one geographic area, they may just go to one. But for national organizations, they're in every chapter. And we've got quite a few are in every chapter. And a home modification company, give us a call. You want to talk to Julie Wagner. She manages today. So we have this new person on board, the corporate partner program for us, and we'll talk to you about how you can get involved.
Great, good. Now you had mentioned somebody had asked. You had mentioned somebody managing multiple practices of care managers. Was that an acquisition type thing, or?
We know that there are some companies that manage care management in multiple states. AROSA is one example. I'm going to do tomorrow an introduction to AROSA, who's a member of ours. with a number of care managements in a number of states across the country, everywhere from Florida to California. And Amy O'Rourke is one of their senior managers, and she's a past chair of the board.
We had her on last week.
Okay, well then you know about Amy and
Yeah.
what they've accomplished in Arosa. So that is a company that has multiple offices, multiple locations, multiple care managers.
Okay.
Then we have solo practitioners. We do a quarterly member forum for solo practitioners. These are people that work alone. They may have somebody that they meet with occasionally that they can refer back and forth to. There is a group in San Francisco of solo practitioners that get together every month. And what they are there is to support each other, allow each other to go on vacation or take a day off here or there, because care management is 24/7 for some. For some, it's 5 days a week, 12 hours a day. It depends on the practice. And then we have companies that have maybe one other care manager. I always think of Susie Murphy because I had to drive around with her for a day, or she had to drive around with me for a day. We had a good time. I had a great time. I got to meet some of her clients, and I really understood what care management is after I did that. Susie bought a company, the company she worked for, after the CEO passed away. And she has multiple care managers. I think she's up to 14 plus working for her. And she has other services. She has had, before the pandemic, she had a service where if somebody just wanted to go to a show at the Kennedy Center, they would take the client to the show at the Kennedy Center or take them to the hairdressers. So a lot of our care management practices have different services. And you can find that out by looking at our care managers' websites.
Let's see. Okay, couple of really good questions that came in here. I love this one from Tyrus Madron for Taney and the care managers that are on the call. So some of you might throw this into chat. What are some of the critical factors you look for when considering resources to partner with, i.e. communities, home care, home remodeling like Ollie? What sets the good ones apart? Any thoughts on that?
I think you have to develop those relationships at the local level. And so what I'm talking about, I think back to the days that I sold durable medical equipment in the community in Baltimore, Washington. And I used to take my competitors to lunch. I wanted to know what they knew. And I also used to drive relationships with my referral sources. So it wasn't about just talking about clients all the time. It was talking about to each other and developing those relationships that then allowed me to know that if I needed X was there and they were there for me. Today, I still do that. When my brother came home from the hospital about 3 weeks ago, I called a DME provider in the greater Washington area. And I said, it's a blast from the past. He goes, oh my God, Connie, I haven't heard from you in forever. I had a relationship. He said, whatever you need, and I understand in this area that it may take 2 or 3 days, maybe 3 to 4 days to get a bed in a home, a hospital bed. He said, I'll have it there tomorrow morning. Mm-hmm. And that's the kind of relationships you need to develop with your other providers. So go out to lunch with the money managers. Go out and get a cup of coffee. It doesn't have to cost anything. Go get a cup of coffee with somebody that's a guardian. Work through this. Develop those relationships. You can do it.
Great. And then Heidi Garvis asks, approximately how many case management companies across the nation also provide home care services? And, that's always been an interesting topic of, the objectivity of providing care management, yet potentially having a affiliated service that you are also operating.
Based on our code of ethics and standards of care, you have to give patients choice. So sometimes you can say, here's 3 home care companies. I'm going to tell you honestly, this is the one that employs me. But here are 3. I know of all 3. I think it's freedom of choice. Doctors have to do the same thing. Hospital social workers and hospital case managers have to do the same thing. And you don't have to take part in what they recommend. You can go outside of what they recommend. There are some care management organizations that also have, in some areas, they have, what do they call them? Where they have a list of aids that they can use. Registry, they can have registries. In Maryland, you can't do that. In New York, you can. And so right now, we're faced with a huge shortage of aides, qualified aides in this country. We know that we're really suffering. And so in places in this country where our care managers have registries, they're not feeling that pain. In other places, I know care managers are really sweating it because it's really hard in some places. We have a lot of corporate partners that offer that service. My recommendation is to get to know our corporate partners in your local area, get to know their offices, and work with them. You'll get more.
Okay, great. And yeah, and the interesting, like the code of ethics for a care manager is to provide choice
Sure.
to the consumer. The opposite of that, if I'm operating a home care agency that owns that is affiliated with a case management organization, unless you're a member of a home care provider that has a code of ethics that says multiple referral sources. So going backwards,
But you know,
referral
yeah,
to
right. Yeah. It's interesting, but then that care manager, if they're a member of ALCA, because a lot of times they are, like Connie was, she's bound by the code of ethics. So she can say at that point, you've been referred to us. I can give you choice of who's on my team. And you can also look at other care managers. Here's the website. Go to the website in Fort Lauderdale, see if you want to find somebody else. So, we can do it that way too. The trick here is to be transparent and let the client, the family, the caregiver, and the responsible party know that it's their choice.
Okay, now let's see. Okay, this is a good question. National Association of Certified Care Managers, and so is that organization is affiliated with the Aging Life Care Association, correct?
No, only in one way.
Okay.
They're totally separate organizations.
Okay.
They are separate organizations with separate tax numbers, etc. The only thing that brings us together is that I, with my team at ALCA, are contracted as the back office for NACCM. So Byron, who made a statement earlier, and he can put anything in the chat if he's still on right now about that. Byron is chair of the board. I have a separate board for NACCM. I answer to Byron there. The chair of the board at ALCA is Connie McKenzie, and she's the president of ALCA this year. We answer to her and the board of directors and the executive committee of ALCA. They're two separate organizations, totally separate. And I will tell you that only about 40 to 50% of the people that are credentialed with the NACCM credential, CMC, are ALCA members. So interesting enough, a lot of care managers that are credentialed with CMC are not ALCA members.
Huh, that is interesting.
Isn't that interesting? Yeah.
In chat, I've posted, this was a question relating to other levels of certification. It looks like there's also the Commission for Case Manager certification.
That's CCMC that came out of CMSA. That's totally independent, two different organizations, totally.
And then
they have over 40,000 case managers credentialed. The National Association of Social Workers has 2 credentials for care management. Now, ALCA, when you go to apply and get vetted from ALCA, you want to have one, you can have any of these credentials. We recognize at ALCA 4 credentials. We recognize first the CMC, CCMC, and then the 2 National Association of Social Workers credentials.
Okay, great. And somebody asked if you had any preferences. So obviously the NACCM is probably what you would lean into a little bit more.
A preference? No, I think it's your preference. What do you want? What do you want to do? I think if you start to look at it, if you're a true care manager, I think that the CMC and the exam really talk about care management. If you're looking at the CCMC, go look at what's required. Go look at the broad spectrum of what CCMC asked on their credentialing. And again, if you're a nurse, you may not want the social worker association credential,
Right.
or if you're an OT, PT, a recreational therapist, gerontology, or a counselor, you may not want NASW's credential. But if you're a social worker, you may have gone that route.
Right.
I think Mr. Byron, you went first for one of the National Association of Social Workers, and then he got his CMC. So you're perfectly welcome to have more than one credential too.
Excellent. And then Heidi asks, but this is I'm combining her question with somebody else's. How many care managers are there nationwide? And then Heidi says, are there parts of the country where you could see we need more care managers?
5 states don't have them. We have 5 states in this country, and I don't think I can do it totally off the top of my head. I know there's no care managers in Alaska and Wyoming, but there's 3 more.
Okay,
yes,
well,
they need more care managers. All right, how many are there out there?
Yeah, we just got an Olympic medal from Alaska, so that's awesome. So now we need a care manager.
And I'd be happy to go up there, and that's on my bucket list. Let's see.
How many?
I will tell you that ALCA right now has under 2,000 members. And so if some of my board, they think there's a potential of 5,000 out there. And that's what's in the strategic plan. Go 5,000 care managers. I'm not sure. I really don't know. I do know that there are people that call themselves care managers that work in other modalities. If we're talking about care managers working the way our existing organization members work, that's in either solo or multi-practices in the community. Now, are there care managers that do somewhat of the same thing, may not be as highly credentialed, but have a credential that work in low-income housing and in the HUD housing for seniors? Yes. And those care managers do a lot of the same things our care managers do, but then they may not be as credentialed the same way. They do have their own credential though. Great. So there are buckets of care managers out there. In fact, we are giving the board this afternoon a member potential mapping, and we want them to think about it, because in October we'll go into strategic planning, and we want them to tell us where we should focus on looking for care managers. Other care managers, are they in area agencies on aging? A lot of the area agencies on aging have care managers. We have some members that work for area agencies on aging.
Yep.
So there are a lot of yes, there's a lot of potential out there. Right now we're just under 2,000. So if you know anybody or anybody wants to join, let me know. I'd love to pick up a couple more care managers.
Ada is with a care manager practice, and she says she's been looking for some independent care managers for her practice for over 6 months, and it's been pretty challenging. Any suggestions on how, for those organizations that want more care managers or hiring care managers, any suggestions on how they might go about?
Yeah, we're putting up a job board. So we're putting up a career board. It's not, I don't think it's quite up on the website yet. Julie's working on that with our office, and that should be up very shortly. So you can post your jobs up there. And somebody may want to move this way as a care manager and join this area because they want to move here and be closer to their family in this area. So put it up on the National Career Board. Again, that's the best way I can think of besides running ads. I think that there are a lot of folks that want to come out of hospitals today after what's gone on over the last year and a half. And I think there are a lot of potential care managers that would love to come out and have their own businesses or be part of somebody else's business, like whoever it is, and whoever, Heidi, Ada, whoever just asked you that question. I think you can do some marketing in organizations where you've got some clinical folks that may be interested in coming out and joining you and learning about this great industry. It doesn't require that you go into a hospital every day.
Oh boy. And I just glanced at my watch, and it's 1 o'clock. We burned through time here, and but let me do a couple more here and then we'll wrap things up. Can you talk about aging life care managers serving as advocates, healthcare proxy, or power of attorney for their clients?
That's really a question that a care manager ought to answer. I think a lot of care managers, instead of doing that, they talk to an elder law attorney and figure out what the best thing is to do, and then talk to the family. Maybe engage a guardian. We do have relationships with the guardian organization nationally, and we'd like to have them as an alliance. And we'd also like to have the National Elder Law Attorneys Association as an alliance. We're working towards that. I think that you got to talk to other people. I can't advocate either which way. It's up to the situation. We've got some folks that do it. We've got some care managers that are also guardians, and I would talk to one of those folks. And if you need to know somebody that could talk about that, because you have a question about it, I'm happy to put you in touch with somebody. Just send me an email at thammill@aginglifecare.org.
Yeah. Great.
And I'll shoot you, we'll look and see if we can find somebody that can talk to you about that does some of that work.
Yeah, and the on our discussions that we've had, that is one where some practices are, no, we don't do that, but others do that. So it's really, when you're looking at aging life care managers, talk to a few, and if that's, you may have to make a few phone calls to get to one that's offering that service.
And we can help you with that. So don't hesitate. Sarah knows everybody. Don't hesitate to call Sarah in the office. And remember, if you've seen one care management practice, you've seen one care management practice.
And then I'm going to make this last question here, the last one, and it's and it says, thank you. So what is the best way to start this relationship before you need it, before the crisis happens? And I will say to the person that asked that question, this is every aging life care manager's dream, is that, it's the advanced planner. It's you can call an aging life care manager many years before you may need it. And in fact, a topic that comes up on a regular basis on many of our discussions is the topic of solo aging. And solo aging requires some prior planning. So a lot of the solo agers are working in advance with aging life care managers.
Absolutely.
That being said, I mean, the crisis situation, it seems to be the sweet spot, and the siblings that don't get along and need to figure out what to do and how to handle this, they're great too. But
I'll tell you, Steve, before the pandemic, I did a road trip down to the Money Managers annual meeting with Lisa Mayfield. She, at that time, was president of ALCA, chair of the board of ALCA. And we talked a lot about that. And at that time, her practice was starting to make a turn. She had, at that time, was working with Julie Gray and a number of other care managers up in Washington State. And the turn was having people in their 60s, 50s and 60s coming in the office and saying, nothing's wrong. We just want to plan. We're about to retire. This is part of our planning. If we could get more people to plan, I think things would go much more smoothly for people instead of waiting till you're in crisis. So I'm going to say, if anyone call one, that would be a dream meeting for our care managers. You're just planning it out. And again, Lisa said, and her practice obviously changed. She's up in Washington State, and we know that's where the virus started in the United States, and things are different up there. The Western chapter is having a face-to-face meeting up in Washington State in August. So we'll be going up not August, in September. The end of September, the Western chapter is having a big meeting up there. So we'll be going up there and seeing what's going on.
Great. Okay. I'm just posting some things in chat on solo aging there. Thank you for those comments. All right, guys, this has been fantastic.
Thanks for having me. Thanks for letting me do this. This is great for us. We want to do more of this, because if we can get the word out about care managers instead of what's a care manager, it's just going to help everybody across the country.
I love it.
And we're all aging.
All right. Well, stay in touch, and anything.
I will, Steve. Thank you.
Just reach out.
You too.
Talk to you.
Bye, everybody. Bye.